Next, we are going to be hearing from a patient who we can see on the screen here, Luke Pembroke, who is joining us from across the pond virtually from Greenwich, England. And his talk is entitled Lived Experience, Why I Said Yes to Gene Therapy. Please welcome Luke.
Thank you very much. Bear with me whilst I just get my screen going. I really enjoyed that exchange on the phone just then. That quite possibly has to be the most politely dealt with Canadian thing I've seen. So it's true. You guys are all very polite. I don't think people in the UK would react as nicely in the middle of their presentation. Okay, just going to pull this up. Okay. I hope this is in frame.
Very good, thank you.
Perfect, thank you very much. Okay, so yes, first off, I'll just start by saying my name's Luke Pembroke and I'm from the UK and I have haemophilia B, and I'm absolutely gutted to not be there in person. I think it's quite an important and somewhat poignant point to bring up at the start of my presentation. I was meant to be there presenting in person, and unfortunately, issues relating to a life lived with haemophilia have prevented me from traveling to Canada. And it's definitely one of my favorite countries I'd love to live in one day. And I had a chance to explore it a bit last year. So this is a photo I got of Niagara Falls last year, and that's about as good as I can do for you for not being there in person. So again, really, really sorry that I couldn't be there. So why did I say yes to gene therapy? I think it's first important to look at what life was like with me regarding my haemophilia before gene therapy. So this is sort of just a brief breakdown of how I was managing my haemophilia. So as I went into my 20s, during university, I was experiencing a fair amount of bleeds, and I increased my prophylaxis to 3 times a week, standard half-life, and that really did make a difference. So during my early 20s, I really had my haemophilia under control. And as a teenager, I definitely struggled with it more. When I was on that standard, you have haemophilia B, you get factor twice a week, back when prophylaxis was maybe still kind of in its exploratory phases. I was known to have quite a high annual bleed rate for someone with haemophilia B. At least that's what clinicians told me. I didn't mind going up to 3 times a week because I have pretty good venous access. Can't really see my veins because I've got pasty Irish skin, but they do get juicy under a tourniquet, which turns out is very useful if you go through a gene therapy clinical trial, because you will have more injections that you've ever had before in a very small amount of time, except they're just taking blood out as opposed to putting factor in. I've experienced a fair amount of ankle arthropathy, particularly in my left ankle, which has always been my target joint. And as I grew up, and that worsened over time with increased bleeding and just being generally clumsy and stupid, I did eventually develop mobility issues, but for the most part, relatively active, getting in the gym, going for runs, going for hikes. Wouldn't consider myself an athlete by any means, but I definitely wasn't completely sedentary. And when it came to accepting my haemophilia, I struggled like a lot of teenagers do. I had that resentment towards my condition, particularly as I got older and I couldn't get involved in the contact sports that all of my normal friends were doing. And I did have a tough time with that. But as I matured to some extent, I became a lot more accepting of my condition. And by the time I was into my 20s, I felt like I was in a position where I could say, I don't live with haemophilia, haemophilia lives with me. So things were pretty good. So why go for gene therapy as part of a clinical trial, right? If it ain't broke, don't fix it, some people might say. But I did have my reasons why, and I'm going to touch on those now. First and foremost, I saw it as a really exciting opportunity to potentially experience life without severe haemophilia, which is all I've ever known. So the idea that the treatment burden could be reduced, and that I could kind of be mentally freed from worrying about my haemophilia as often did seem quite attractive. And I'd always heard about gene therapy growing up. My mum always talks about conversations doctors had with her back when I was a baby saying, oh, don't worry, Miss Pembroke, gene therapy is on the horizon. It's only 5 years away. The research is looking promising. And gene therapy was always only ever 5 years away. And as I got older, I just kind of figured, it's not going to be anytime soon. Maybe when I'm an old man in my rocking chair, they'll have cracked gene therapy for hemophilia. But for now, I'm interested in the science. I'll keep an eye on it, but I don't really see myself being someone who gets a chance to receive it, at least not until I'm an old man. And despite being an old man at heart, by the time I had a chance to experience it, I was only 25. So it kind of, in a lot of ways, somewhat snuck up on me. But I was regularly attending bleeding disorder conferences, and it was always increasingly on the agenda. And it's great to hear all these leading clinicians and researchers talk about the science behind gene therapy, but then there was always a lot of discussion around the potential long-term effects and the known unknowns and the unknown unknowns and all of this really complicated stuff that are important conversations to have. But a couple of years, it felt like we were just saying the same thing over and over again. And there was this thing niggling in the back of my mind, like, well, without trial participants, we're never going to have the answers to these questions. So it's all good that we keep asking them, and we have to, and they're important conversations, but we need people to step up to the plate, if you like. And so I saw it as a really cool opportunity to help progress the science and give something back to the wider community as someone who I would consider to be relatively lucky in terms of how I've grown up with hemophilia. But it was not an easy decision, and it was not a quick snap decision. So just to give you an idea of the series of events that led up to me saying yes and going for gene therapy, it happened over the course of a couple of years, in actual fact. That's probably longer than most people, but I think it should never be a decision that's taken quickly and lightly. I probably took that a bit too far, but when I was first approached about gene therapy, I was interested, I was curious, went through the screening, and then I looked at the commitment it required and everything I had on in 2019. And I just knew in my heart and my head that I can't commit to this right now. And whilst it's interesting and potentially one day I'll put it to the back of my mind. And then by the end of 2019, the conversation came up, and thanks to really understanding colleagues at work and discussions with friends and family, I finally nailed down a date. And in February 2020, I got dosed with gene therapy. So that you can see me there in my hospital, basically the room they treat you in. It's very ordinary, and I was just hooked up to an IV, and over the course of an hour, gene therapy was administered. I was then given prophylactic immunosuppression about a month, 3 weeks to a month afterwards. And then the craziest thing happened in 2020, which didn't mix well with having a suppressed immune system. But if I got into all of that, we wouldn't have time. So if you are curious, I made a video documenting that first year experience of going through the trial, which was very, very intense. And one of the hardest things I've ever had to go through. I wanted to touch upon some of the unexpected elements of going through a gene therapy trial. And we always talk about making sure the patient is prepared and ready for any possible outcome. But until you're in the trenches, you just don't really know how you're going to react to a lot of the things that came up. So the immunosuppression, I was told about the side effects. I was given the long list, but until I was actually experiencing them, I really did not expect them to impact me as severely as they did. And the immunosuppression I received made me feel the most ill I've felt in my entire life. And I was debating on putting up a picture of myself when I was on the steroids, and I decided against it, but they are out there somewhere on my YouTube video of my big puffy face and generally looking like a zombie. I would gladly never go near corticosteroids and tacrolimus again ever in my life, because it was a horrible experience, and it gave me an appreciation for people who have to put up with taking those medications far more regularly. Also handing over the reins. I'm so used to managing my hemophilia independently, and now I had to trust it in my care team to handle everything all over again. So that was an interesting thing to adapt to. I also developed a weird obsession and somewhat of an anxiety around my factor 9 levels, particularly as they started dropping off in the sort of 1.5 year mark onwards. And that did concern me quite a bit. And it's not normal for someone with severe hemophilia to be getting their factor levels as regularly as you do in a gene therapy trial. Because prior to that, I would, know my factor levels maybe like twice a year when I went in for my visits and had a pre and post factor level check. So that was strange. And it also made me reflect on some of the damage that had already been done and kind of wishing, my ankle wouldn't have been as bad as it is if things were different growing up. And so, I kind of mourned the loss of that ankle joint upon reflecting where I now was in a post gene therapy life. But ultimately, this quote resonated with me finally. I didn't know I needed it until I had it. And this is actually a quote that a nurse told me one of her patients who went through a trial, gene therapy trial, said. And I remember when I first heard it, it was before I had gene therapy. And I thought, wow, that's really interesting. And kind of didn't think about it too much. And now I just totally get it, having been through the gene therapy experience. And it just makes me realize how many little things do add up when you're living life with severe hemophilia. And we're also used to just adapting to it and getting on with it because it's just what we have to do. And then all of a sudden, not to have to do those things is a really strange but great experience. And I don't go around going, oh my God, gene therapy has changed my life. It's amazing. It's just these little things day to day. You're kind of like, oh, remember when I had to do that? Remember when I'd forget to do my factor as I was rushing out the door? And I still have moments now where I like bang myself on a door handle or something and go, oh, factor. Oh, no, wait, I'll probably be okay. And it's a nice experience to get used to. Good problems to have. So looking at my outcomes so far, my factor expression puts me in the range of someone with mild hemophilia. So I'm still part of the club, thankfully, I guess, best of both worlds, maybe. But, with mild hemophilia comes its own unique challenges that I'm going to have to get used to and be wary of. But I do feel mentally freed from my condition, absolutely. And I feel like I can live life more spontaneously. Unfortunately, the chronic damage in my left ankle has taken a downturn in the last 6 months. And I'm working with my physios and the orthopedic team to come up with some solutions and options there. Just had some imaging done this week, actually. And that's the reason I'm not able to be there with you, unfortunately, because I'm not very mobile at all at the moment. But there is some kind of weird comfort in knowing it's not an internal bleed that's going on. And the imaging and the clinical assessments back that up. So, I'm dealing with annoying joint damage. The last thing I want to do is deal with a bleed too. So it's nice to know my ankle isn't bleeding. I have had one bleed, very minor, and it resolved without treatment. And then I had one dose of factor. It's the only dose of factor I've had since receiving gene therapy. That was prior to having a steroid injection in my ankle. And just about 3 and a bit years on from receiving gene therapy, I still have no regrets. So some of the highlights, just to round it off. As I mentioned last year, I got to explore your amazing, incredible country and hike some of the national parks, clocking up 30,000 steps a day on this gammy ankle and not having any bleeds. I was more worried about, avoiding bears as opposed to avoiding bleeds, and just getting out there and seeing the world. And I got to live in the Amazon rainforest for 2 months, and my factor boxes got absolutely demolished by ants. I got attacked by 2 rabid dogs in Cusco, and I had to, go get rabies jabs and tetanus jabs. And I went through all of this, and at no point did I have to take any factor. It was just absolutely wild to not have to worry about my hemophilia in a way that I've never experienced before. So just to close it off, future considerations for the community. We need to think more creatively about how we educate a wider patient audience and make sure that people who are considering gene therapy really understand what it is they're signing up to. And I think there's a real opportunity there for peer-to-peer support, where those who've been through gene therapy are given more opportunities to share their story and speak with those who are curious about it, or perhaps considering it themselves. And obviously we need to tell our stories in a subjective manner, but I still think, coupled with the science and the data and the educational materials, those kind of personal stories and anecdotes are really what people latch onto. And I really hope to see gene therapy as an option for the many and not just the few. It's great to see these advances in the medicine, and I truly believe in the potential of genetic medicine, not just for people with hemophilia, but other rare bleeding disorders and other rare diseases. But I don't want to see that treatment gap between those that already have access to pretty good treatment as it is, and then those in the developing world who are struggling to even get basic, factor prophylaxis. And then lastly, making sure we do not forget how important haemophilia treatment centers are, even post gene therapy. Just because you might have sorted out the factor expression and bleeding doesn't mean that there aren't going to be other things that people with haemophilia need. And it is a complicated condition, and the specialists in these haemophilia treatment centers are so important. And I've experienced that firsthand recently with just how much I've relied on my physiotherapist team. So we got to look after our haemophilia centers. We're still going to need them in a post-gene therapy world. Anyway, I'm sorry if I've gone over time, but thank you very much for listening in, and I welcome any questions at the end of the session.
Thank you so much, Luke. It's always so helpful for all of us to hear our patients' experiences, and it really helps us to provide better care for our patients. We'll hold questions for Luke until the panel discussion at the end, so hopefully he can hang out online for us.